Assalamu Alaikum, everyone, and a very good evening to you all. I, Fahim Ahmed Mojumdar, along with our speakers, Mr. Sabik Intesar, Subhani Alfi, and Tuan Chaudhuri, welcome you all to Project Untrap Presents Utopian Dreams
Hmm.
podcast. The topic of today's podcast is masks, a dilemma or a rigid fact. We have a very special guest with us, Mr. Minhaj-Ul Hossain Maruf Bhaya, who have passed medical MBBS from Dhaka Medical College and doing his internship now. So let's welcome our guest, Maruf Bhaya, and we can start our podcast now.
Okay, let's move on to our first question, which is that from the start of our pandemic, we were facing this controversy whether mask is useful or not. Some studies were showing that the virus could penetrate the mask, and some were arguing that a mask actually is very quintessential for preventing the virus. So, what's your take on this?
Okay, thank you, Fahim, and thank you, Sabik, for giving me the floor. And also thanks to Project Unprep for arranging such a nice initiative or initiating such a nice podcast. Uh, uh, my take on the controversy regarding marks should be like this. There has been there has been differences in thoughts about wearing masks, but the scientific researches, most of the scientific researches suggest that wearing a mask can significantly reduce the amount of COVID infected patients. You say there are different types of mask, like surgical mask, face mask. Also, we have N95 masks, which are called respirator mask. So you see, there are different types of masks, and which with their varying functions, varying degrees of functions. As for example, if we are using usual cloth masks, which are fabric masks, so their degree of penetration, their degree of permeability is more, what shall I say, more they are more permeable than surgical masks or respirator like N95 or N99. For our daily life, we are using face masks like fabric masks, or what shall I say, surgical masks. There has been researches that shows that in Hong Kong there was a research that shows that if you wear masks, masks has significantly prevented influenza-like illnesses in a pre-COVID setup, where there was a 80% efficiency in reducing influenza-like illness for wearing mask. Also, there has been a research in China which shows that if you wear masks on a regular basis, this was during a COVID setup, that the work setup that used surgical masks or masks, they were almost 90% less prone to infection than the areas where there were not there were not work setup for there was a non mask working setup. So this shows that we should, despite the debates that are going through the world, we should stick to the basic that wearing masks can significantly lower the incidence of COVID-19 incident.
That's really interesting, and I think we are all aware that Bangladesh is very congested and highly populated country. In fact, last time I looked up, Bangladesh was one of the most is actually the most densest in terms of population. So often the places get very crowded. We can see in the buses there are a lot of people gathering in the masjids, in in concerts or in bazaars. So, how effective do you think the masks are, especially in the context of Bangladesh?
You see, the problem here is, the perception of max functions. What does it serve? If you understand the function of a max, what does it serve to the user, then we can easily understand whether we should wear a mask in a congested setup or not, or is it really efficient or fruitful, or what should I say, useful, wearing masks in a congested place like a bus station, or in a crowded bus, or in a crowded marketplace. You see, if I talk about a normal surgical mask, the major aim of surgical mask is to, contain the source of infection. The meaning that the user who is wearing it shall not pass any infection towards anyone out there. So, say there is a congested place like, marketplace or crowded bus. Someone is wearing mask who is a COVID-19 patient. Uh, so if the user is wearing the surgical mask or the mask which he should be wearing, there are less chances that he will not be passing any viruses through his respiration to the others.
अच्छा
But
भैया हमारा
the
किसी
major
क्वेश्चन
the major
किसी
aim
अभी
here, the major aim here is to not the major concern is not the distance between the two. The major concern is when we are doing inspiration and expiration, we should not let our expirated material pass to the other. And the major role the mask plays is not the distance it created, rather the barrier it created. So even if the person is in a congested place, it significantly plays its role perfectly. You see, whenever another major aim of a wearing a mask is, the COVID-19 or respiratory flu-like illnesses. What should I transmit through droplet infection? So, what is droplet infection? Droplet infections are infections that pass through coughing or sneezing. So, if you are wearing a surgical mask, when you are coughing or sneezing, uh, during our coughing or sneezing, we continuously create, droplets, and whenever there is droplet coming out, they go into two bins. One is larger droplet, the other is smaller droplet that we call droplet nuclei. The larger droplet, usually they are more than 5 micrometer. The larger droplet group, more than 5 micrometer in size, in diameter. And the smaller droplet group that we call droplet nuclei, these are less than 5 micrometer. So the more than 5 micrometer larger droplet group, they fall on the floor. They fall on the floor and not necessarily travel through the air and goes to other persons and create, havoc of infections. The many problem is basically created by the other droplet group, which is droplet nuclei, and they are of size measuring less than 5 micrometer. So they travel through the nearby, they are nearby persons or people who are roaming around here and there, or who are in close contact with the person who is infected with COVID-19, and inhale the droplet through their respiratory system or into their body, and they then get infected. So you see, the most of the marks, especially the N95 marks, which basically we do not suggest, or WHO do not suggest for the normal people. The normal people shall use surgical masks, and N95 should be used by, you know, people who are serving COVID-19 infected people, people who are collecting a specimen for suspected COVID-19 patient. So I will skip this N95 masks. I will talk about the other masks like surgical masks or face masks, or there is called bandana. People wear masks like a handkerchief or something like this. So there has been research, or there is this is evidence by that the efficacy of bandana is 9%, and surgical mask is 52 to 88%, and normal face mask, that is cloth mask or oven mask, that is 32 to 40%. So if you see, uh, also there has been this suggestion that people should maintain the minimum distance of 6 feet from the nearby person, so that virus does not necessarily travel through the other person, or does not necessarily travel through the air and infect the other person. In crowded place we cannot, you cannot maintain this distance, so that we cannot rule out the probability of getting infected through the droplet nuclei, but we can surely rule out the chances of, not getting infected by large droplets which are more than 5 micrometer. Also, you should know that whenever a COVID-19 virus diameter is zero point 0.1 micrometer, and not necessarily it is not associated with the pore size of a surgical mask. The surgical there is whenever you are passing through a point, the permeability depends on two factors. Many The mechanism of mask is designed in such a way that it can prevent it can do two types of prevention. One is mechanical prevention, that is through the, the minimum the gap is, the maximum the efficacy is. And the other is, that create a electrical, the outer layer is, it creates an electrical effect, electronegativity. So the there is a repulsive effect that is created in the outer layer of a surgical mask, and that inhibit an a COVID-19 virus to transmit through it. And there is research has shown that almost 70 to 80% of virus cannot travel through the pore due to the mechanical and electrical barrier it creates. So I think we can significantly, or we can more or less we can clearly say that even if we are in a crowded place, we should wear surgical masks, or whatever the masks we are wearing, because wearing nothing is wearing something is better than nothing in a crowded place like marketplace or bus, and we should stick to that.
So, I have a question regarding the surgical and the K95 mask. Now, a
Yes.
lot of people actually wear K95 mask, but they don't wash that mask. They wear the same mask again and again, again and again. Does that increase the
Yes.
possibility of infection?
Okay. Thank you for this question. Okay, you see, the first thing is, mask people should not wear KN95 or N95 masks, because the resource is limited, and we cannot afford in a country like Bangladesh to use a huge amount of KN95 or N95 masks on a regular basis, because you have seen that in the last few months of 2020, no, sorry, in first few months of 2021, there was a surge in price in mask, due to the the demand and supply issue. There was a huge demand for masks, and people were exploiting the supply demand crisis. So I think we should not encourage the normal people to wear KN94 or N95 masks, because it is not economically viable. Yes, who are rich, they can afford it, but also whenever they are buying it, they are creating a pseudo crisis, for the supply of these masks, and their prices are getting increased. And I have to provide my healthcare persons with these masks, and with the prices getting increased as the demand is getting increased day by day due to unnecessary buying of these masks from the mass people. I don't think this is a good way to combat COVID-19 battle. Now come to what about the take in wearing KN95 masks for day in and day out. You see,
And to
research
add to it,
research
I have
research show.
another thing to add to it, Bhaiya. Um, Besides the K95, there is another mask. Like, have you seen the Yeezy masks? They were available. Like, shops were selling Yeezy masks for around 300 to 400 taka. Let me stream it. Wait a minute. Let me stream it. Yeezy mask. Uh, if I have a look at it, sharing my screen. Is my screen visible?
No, I think Fahim should allow
Is my
you.
screen is my screen visible?
Yes,
Not
your
here.
screen is
Yeah,
visible.
it's not.
Asha. So,
Okay.
what are your thoughts on this sort of masks? Like they were being sold at shops for taka 500 or 600.
Okay.
These masks.
Oh, what is the model of these masks? What is the name that is called on?
It's Yeezy Boost V2 face
I
mask.
think these are. I think these are basically fabric masks. I think his is like the
What is
design
the
name, but
what is the name? Can you tell me the name?
The name of the mask is Yeezy Boost 350 V2
I'm
face
not
mask.
getting it. DZ or
Adi-
easy?
Yeezy, Yeezy.
Adidas. I think it's from
Oh,
Adidas.
Acha. Okay, okay.
Fabric masks. I
Okay, I
think
got
these
it.
are.
I got it. This is easy from Adidas. Easy mask. Okay.
Yes, ma'am.
Uh, Let me see. I can confirm you what this type of mask. Easy mask from Adidas. Like,
Z-Way.
okay, okay.
YZY.
This is also effective in filtering. There is a filter out there. You see, like there is a globe shaped thing outer on the outer side of the mask,
Yes, ma'am.
and it allows the air to. This is a filter that is a one way valve that allows the user to exhale out the exhale out the air, but the user not necessarily inhale outer larger particle. This is also effective. It is not a fake mask. This is a modified marks which are of higher efficacies, and people can use it. Okay. Now
Okay.
That's not bad.
coming. Okay.
Yeah.
Hello.
Please continue. Please
Now
continue.
coming to the main question. The main question was whether how what is the efficacy of using KN95 day in and day out. So KN95 marks. These marks are designed to filter out almost 95 to 99% of the viral particles. So we can almost surely or almost surely say that this is a very good mask to wear. But what is the efficacy of wearing it in day in and day out without decontamination? So you see, the COVID-19 virus has been said that COVID-19 virus at best survives for up to 72 hours on surface objects. So what the people can do is they can buy multiple marks, and they can number the marks 1, 2, 3, and use them alternately after 3 days. And in between the days, they can keep it in sunlight, or they can keep it in a closed box with silicone jelly that can demoisture the marks. That is how they can use it.
থ্যাংক ইউ সো মাচ ভাইয়া। আমরা
Okay.
অ্যাকচুয়ালি এই যে অনেক কিছু জানতাম না, আজকে আপনার কারণে
Okay.
অনেক ইনফরমেশন পেলাম, and thank you so much for this. And I have a question regarding the topic today. So, as a clinician and as you have been in the medical field for quite a long time, so from your personal observation about the effectiveness of wearing mask, uh, is wearing mask effective to combat COVID-19? And as you have observed some patients yourself, up close and personal, I guess. So, what's your personal observation that
Sorry,
can
Paim,
we
I could not hear the last part of your question.
Okay, so as a clinician, from your personal observation, how effective do you think wearing mask in combating COVID-19? I mean, how masks are effective, or are they
Okay.
really effective or not to combat
Um, um,
COVID-19?
okay, this question almost I would say similar to this. The answer would be almost similar to the first question. I have seen in our patient groups, we have seen a significant decline in infection of COVID-19 who were using masks on a regular basis, rather than the people who were not wearing masks. Also, we were people who were moving randomly for nothing were more infected than the people who were moving less. It is not like the thing is, it's not like a binary thing. Like, it's not like 0 or 1. If you are wearing a mask, you will not get infected, or if you are not wearing a mask, you will get infected. This is not a binary thing. This is more of like multiple layer of gray areas. The more the chances get lesser, as much as you are getting as much as you are sticking to the principles of wearing masks. This is not like there is no 100% guarantee uh, that you will not get infected even if you are wearing a COVID-19 mask, because we are saying that even N95 masks are give you 95% protection. There is 5% chance of getting infected, so we cannot rule out that. And we have seen the same in our patient group as well. They were getting infected, but there were lesser people infected wearing a mask on a regular basis, but then the people who are not wearing masks on a regular basis. And we should, and also people who are handling the masks on a proper way is also important. People, I always see people on the street, or even some of our relatives or friends, do this, uh, tucking the marks on their nose, and then drawing it to their, jaw, and then putting it again. This also, decreases the efficacy and efficiency of the marks. So
Yeah, so
for this same reason, more educated and more conscious people have lesser incidence of getting affected with COVID-19 who wear masks than the people of low education and low conscious level. Obviously, on the basis of consciousness about COVID-19, and they are wearing masks, but they are not as educated and conscious about the thing, they are getting more affected than the people who are wearing masks, and also they are educated. So they know the proper way of wearing a mask, and this is enhancing their capacity to fight and combat COVID-19.
Yeah, I do agree with you that people who are conscious and who wear masks properly, their chances of getting infected is very low compared to people who are not conscious and who take it for granted that they'll not get coronavirus whether they wear the mask or not. But I get this question a lot from my subscribers, which is that a lot of people, when they wear masks, they think that they have to wear mask 24/7. So I want to know your personal opinion. Do you think people should wear masks at their home, or when they're away from public gatherings, or really when they're isolated from crowds? Do you think it's really necessary for them to wear masks 24/7,
Uh, uh,
regardless of whether they have corona or
so,
not?
okay, nice question. I have a few information regarding this. WHO recommends for public. I have to tell it from. I have written down this for you guys. WHO recommends for public. mm, Wait. আচ্ছা, আমরা যেটা বলি সেটা হচ্ছে WHO রিকমেন্ডেশন হচ্ছে আমরা রিইউজেবল একটা নন মেডিকেল মাস্ক আছে, যেটা কাপড়ের মাস্ক, নন মেডিকেল একটা মাস্ক আছে, এটা হচ্ছে নন মেডিকেল মাস্ক মিটিং গুলার জন্য পড়তে হবে, WHO যেটা বলে। ঠিক আছে, উই হ্যাভ টু ওয়্যার নন মেডিকেল মাস্ক মিটিং। দিস ইজ নন মেডিকেল মিটিং, মানে দেয়ার ইজ নো মেডিকেল পারসন আউট দেয়ার অ্যান্ড দিস ইজ এ নন মেডিকেল মিটিং, and then you can use reusable non-medical mask for that meeting. Also, we have disposable masks. And for disposable medical masks, WHO recommend people is 60 or over, or people of any age with underlying health conditions like chronic respiratory disease, cardiovascular disease, obesity, diabetes mellitus. They should wear disposable medical masks. Or anyone feeling unwell, people with mild symptoms, they should wear masks 24/7. I think I got you covered. Hello. Okay. Also there is another portion that say like KN95 or respirator, that is medical mask. That is not surgical mask. Respirator. Respirator should be worn by the caregivers who provide care to COVID-19 patient, also to the healthcare workers who are collecting, sample from COVID-19 patient. Also, it is seen that I am not sure about the organization, but it is said that some organization discourage to wear masks for 4 hour discourage people not to wear masks, for 4 hour at more than 4 hour at a stretch, because people inherently don't stick to this point. As time passes, whenever you are wearing masks, as time passes, it gets tougher to stick to that mask for a longer period of time. Breathing difficulty increases as time passes, because as time passes, the marks become wetter due to the respiration process. There is humidification of the marks, and this humidification causes the breathing process more difficult. So people tend to, some organizations suggest not to wear masks at a stretch for 4 hours. But you can, in a day, one people can wear a mask almost 8 hours at a stretch, if needed. Also, I would say people should not wear masks in a closed setup like regular in your living place. You should not wear masks 24/7. If you are staying in your room, or if you are staying to your bedroom, in your flat, also there are only 1 or 2 person, that is not a public gathering, and you can maintain the distance, that is social distancing, 2 meter or 6 feet. You can maintain this distance. Also, see, like, if you are in a open field, you are in an open football field, you are doing morning exercise, and there is no one out there in the field, there is no necessity of wearing masks. If you are going to the bathroom, there is no one out there, you are alone, you should not wear a mask. Or if you are if you are living in a house that is not infected by any covid patient, any covid-19, that is not infected by covid-19. Oh shit. Lord, hello, my phone is,
Yeah, and it is very difficult to wear mask in the house actually.
there is no need of wearing mask in house setup.
Yes.
What, in short, if I say,
Mm-hmm. Acha, I have a question. Like, can we reuse the masks by washing it, and for how many days we can use that?
okay, I would say about the face masks, normal
Hmm.
fabrical masks that we are using these days, নর্মাল যে কাপড়ের মাস্কটা ইউজ করে আর কি নর্মাল মানুষজন,
Hmm.
অথবা nowadays people are using surgical masks a lot. These two masks. For surgical masks, there was a research in University of Alberta uh, regarding the process of decontamination or sterilization of surgical masks or face masks. It is seen that if you use heat, 65 degree centigrade, if you are heating up to 65 degrees centigrade for over 15 minutes, the mask is significantly sterilized, and there is almost no contamination in that mask, and you can reuse it the next day. But also, you should not use a surgical mask, a disposable surgical mask, for more than 7 days. But if you are in a, also there has been seen that the efficacy of sterilization or decontamination significantly decreases as the air getting less humidified, or the air is dry. When the air is dry, you have to increase the heat even up to 100 degrees Celsius. So there is a WHO gave a for fabrical masks, WHO suggests you should decontaminate or heat up to 60 degrees Celsius at least once a day. That is enough for a mask to be decontaminated. Also, there was another method that calls use soap or detergent. Use soap or detergent, then wash up it with normal water for 1 minute, followed by 1 minute boiling. This could give you the protection as the newly bought mask.
And to add to
Yeah.
it, a lot of us are into sports. So
Hello.
suppose someone is playing
Hello. Sorry,
badminton.
I'm not. বুঝতেছি না আমি।
আচ্ছা ভাইয়া, মানে এখন কি বুঝেছে? এখন কাজ শোনা যায়?
তোমার মনে হয় একটু নেটওয়ার্কটা খারাপ।
Acha, okay. I have a
আচ্ছা
follow-up
আচ্ছা
question.
এখন হ্যাঁ, ওকে।
Okay, okay. Tuan can continue.
আচ্ছা, সো কথা হচ্ছে যে অনেকে আমাদের মধ্যে ফুটবল আর ক্রিকেট খেলে থাকে। সো ওই টাইমের মধ্যে যদি আমরা মাস্ক পরি, আমার একটু রেসপিরেশন একটু সমস্যা হয়। ওই টাইমে কি করা উচিত বেসিক্যালি?
football, wearing any physical exercises or doing any recreation activities like high yield recreation activities like football or cricket or any outdoor sport like badminton or TT. Uh, we strongly discourage wearing masks in such scenarios because this might create respiratory difficulty and create severe problem. People might even go to coma for oxygen less for what shall I say? Yeah. If you're not body getting enough oxygenation, or if your body is not getting oxygenation, you might even go into coma, or respiratory distress. This can leads to hyperventilation. So this is highly discouraged to wear masks in a uh, outdoor game sports like cricket, football, or anything like that. But also we discourage to play cricket or football or something like this in a with a group of people uh, who might be COVID infected, or some of them might be COVID infected, or some of them were in contact with established COVID-19 infected person. The group has to take their own responsibility and rule this out
Uh,
that none of them are COVID-19 infected, or none of them are in contact with any known COVID-19 infected person.
So
And then they can.
another question to add up. অনেকে দেখতেছি ইনস্টাগ্রামে রিসেন্টলি একটা ডে দিতেছে যে টিএইচসি এই কম্পোনেন্টটা নাকি আবার আপনার কোভিড কমাতে সাহায্য করে।
আচ্ছা,
Like how much logical is this?
আচ্ছা। Uh, uh, there has been I also আমি নিজেও আসলে এটা দেখছি যে ক্যানাবিস can
জি ভাই
play a
এটাই।
significant cannabis can play a significant role in combating COVID-19. And this is almost a new research, or this is only started. This research has recently started. I think if I had to say something regarding this, we should wait and see what is the actual result or info is. We should wait. I should not comment on this. This is not established. We have to see a lot before we say
Yeah,
something.
I have a question. I have a follow-up question. Like, we have seen that Bangladesh, the COVID spreading in Bangladesh is quite less compared to the European countries, and but Bangladesh is a highly populated country, and COVID should have spreaded faster and in a more bad way in Bangladesh. But reality
Oh,
says otherwise. Like, also,
Oh,
from my personal experience, I have seen that in the slum areas where people are not conscious about their health or about wearing masks or taking effective measures to combat COVID, uh, the rate of COVID is less. So why do you think it's like that? I don't have enough data to back my claim up, but just it's my personal experience I've seen in the slum areas, or the poor people in Bangladesh are not that much aware about COVID, or they don't care
yeah,
about COVID that much.
I got your
They're
point.
not that much
Uh,
affected. Yeah,
okay, I got your point. Uh,
yeah.
you see, uh, I would say this is there are so many reasons for having lower number of cases compared to advanced country like UK or America. One of the reason is we have uh, the amount of test we do on a day or even in a month is equals to the amount of test USA do in a single day. So we cannot confirm, or we cannot surely say that we have a lower incidence of cases of COVID-19 in our country. But yes, we have seen lesser rate of mortality. Uh, there were less casualty considering to other advanced and developed countries. I think this might be for the reason that the virus got weaker as it uh, travel traveled through the regions and came to us far later than the other regions. Also, there has been this theory that people exposed to germs on a regular basis are uh, less likely to get infected or severely infected by a germ because they are constantly in germ exposure, and they have better immunity than the people who are in a clean environment with lesser exposure to germ. The air in UK or USA, that is almost pure air, less pollution, because in our country we are almost living in something like we have almost the worst air in the world. Dhaka has the Dhaka has the most polluted air in the if I remember properly, most polluted air in the world. So we have already many things going here in our country. So virus like COVID-19 might not uh, be that much tough cookie for us, or the majority of our population our is poor. uh, they don't maintain hygiene, they are not well educated, they don't have proper nutrition, always in exposure to germs, so they have a better immunity to some extent, I would say.
Oh, that's actually a very
So we
interesting
have
point.
to live in slums to get the
Yeah,
good,
yeah. I think that
better.
would be the better alternative.
Yeah, huh. Hey,
Immunity.
this is common phenomena. If you were exposed to hardship, more hardship in your life, then there are possibilities that in your future life you will handle hardship more easily.
Okay.
Bhayan, regarding the current COVID situation, the government is planning on giving a lockdown again. Now, how much efficient is it to give a lockdown at this point? What do you think?
Sorry, Tuan, I didn't get you, or I didn't hear you
So,
properly.
Bhaya, regarding the current situation, and currently a lot of people are getting affected by COVID. So, keeping this situation in mind, the government is imposing another lockdown. Now, how much
Okay,
efficient will this lockdown be? What do you think?
okay, that's a good question. So the major aim of a lockdown is to the reduce public gathering, or creating you know causing less public crowd, or less public meeting, or allowing less people to interact with each other. So the lockdown is a mechanism that we use for battling or combating any pandemic from a very early time to this 2022. The the what lockdown does is it prevents the virus to spread rapidly in a very short time frame, rather allows it to spread in lesser rapidly but in a larger frame. You cannot prevent the virus to uh, completely transmit. You cannot prevent the virus to, you cannot stop the virus from transmitting without causing infection to a majority of the population. The aim of lockdown is to, lengthen the period of infection, but decreasing the number of infection on a single day, so that the healthcare facility does not necessarily get overwhelmed in shorter time span. The idea here is to buy time for combating the virus. We want to buy time. We need more time so that we can create more power, more resources, and more we can provide more spaces, and we can combat lesser cases on a single day. That is the main aim of a lockdown. We don't want to combat 1 lakh cases on a single day. Rather, we can do it 10 days. We can combat 1 lakh cases in 10 days. The 1 lakh cases will happen now or in future, but our aim is to lengthen the period so that we can address every cases, treat them properly, and send them back to home with a with proper medication and care, such for and thus decreasing the rate of mortality and combating the virus more effectively in the long term.
Okay, Vaya, so we can now move on to our next question. Uh, till now, whatever you said was actually very interesting and very insightful. So we are all university students, so we are all aware how poor the university safety protocols are. And so some people advise us that students should maintain safety protocols like wearing masks all time when they're in the campus, other than when they're eating or sleeping, especially when they're in the dorm. And other people recommend, another group of people recommend that universities should be closed altogether. So, what do you think would be the best option in this case?
Um, I think COVID-19 has been playing a mysterious role over the last 2 years. Uh, we have seen surge of COVID-19. We have seen slow rise of COVID-19. We have seen sudden rise in mortality rate, and then we have seen a significant decrease in mortality rate. We have seen disappearing COVID-19 cases, and then now also reappearing, causing deaths. Initially, there were almost no deaths, and nowadays, today, there were, I guess, 31 people died the last day, and the cases are almost equals to 13,000 or something like that. Uh, I personally have been infected with COVID-19 twice. Once in 2020, once in 2020, another in 2022. Uh, once the first variant of COVID-19, that was I guess that was Delta variant, and now I guess this time I have been infected with Omicron variant. You see, what I have experienced or what I have seen is Omicron variant is highly contagious, but this is these have significantly lesser mortality rate comparing to the type that happened in 2020 in our country. So, but also at the same time, even if the mortality rate is very low, with increasing number of cases, there will always be a huge number of mortality. You say there is 13,000 cases today in our country and 31 people died. So, if I if the cases were 1,30,000, then there would be 310 people dead, more or less. Or if there were 1 crore people, then the number of deaths would be like 300, 3,100. And if almost entire population were infected by this, then there would be 31,000 death cases. So as number increases, the number of cases increases, there will always be increased number of deaths, no matter how low the death rate is. So, in current scenario, given the current scenario of 2022, I think shutting down the campuses, campuses for offline classes will be a good move, because we are almost accustomed to the online classes. People can, students can attend online classes, and go through the year and progress in their career. Also, at the same time, banning the public dorm or hall might be a bad choice, because banning or shutting them off for now will cause a rush of people running down or going back to their roots or native villages. There will be huge gathering of people. Rather than staying, let them stay in their public dorm. These will allow lesser gathering of people, or these will prevent mass gathering, or this will prevent sudden rise of COVID-19 cases. Also, at the same time, varsity students, surely they are educated, they are conscious, they should maintain their personal safety protocols. They should wear surgical masks. I would say for public university student, they should wear surgical masks almost 24/7 a day, because uh, with almost no exception, most of the public university students live in a room with more than 5 or 6 people. They share a bathroom which is used by almost 100 years of them. They eat on a dining space that is used by almost thousands of them. So apart from sleeping and eating and going to the toilet, uh, they should wear masks almost all the day. Even if this seems quite impossible, but they should do as much as they can.
Thank you, Vaya, for your insights. We actually learned a lot from you, and I actually agree with your point that classes should be online. Actually, you might be aware that we all have spent most of our university life in online. Actually, I have spent 75% of my university life online. I don't even know what university life is. You know,
That
I
is
only thing I know
that is
that I
sad
was single.
to that is sad from a varsity student perspective, because he is not enjoying the campus life. But also, we have to accept the reality and uh, move out of the bubble of a happy, or uh, what shall I say, a perfect varsity life. There is nothing called perfect. There are always pros and cons of everything we are
Yeah, and on the other
deciding.
hand, some people who are not technologically privileged are always suffering because they don't have good Wi-Fi connection, good
Yes,
internet.
yes,
That's
yes, yes.
also a
But
caveat
but
from
uh,
this case.
but I think the government should take steps, or the varsity concern should take steps for this, because we are now a country which is advanced to the state where internet connection has reached to the almost all the corners of the country, all the remote corners of the country. We can have internet connection even in Saint Martin. You know,
Yeah, actually.
when we are going to Saint Martin, we have internet connection there. We are not using Wi-Fi. We are u- using mobile company's internet connection. So even if Saint Martin has internet connection, then I think the whole Bangladesh can have that, and we can acclimatize on that and do the rest.
Okay, so before we move on to the next question, if you had to make one recommendation so that all the people in the world could be aware of wearing mask, then what would be that recommendation? If you had to make one suggestion, what would that be from your experience?
God, I miss করছি একটু বলো তো আবার. I missed the
Okay,
question.
if you had to make one suggestion or recommendation so that all the people in the world could wear masks, then what suggestion that would be from your personal experience?
Uh, I'm not getting your question. Mani, what is what suggestion for wearing a mask?
Yes,
Wha-
only one suggestion. If you had to
Only
make
one,
one suggestion
only one suggestion for.
for wearing masks to make people aware for wearing
Okay.
masks.
Oh, okay, okay, I got you. Fine. How to create awareness among the people, or the suggestion that might create awareness among the people, so
Yeah,
that they wear
what
masks.
do you think would be the best
Okay.
one? Like if you
What
had to
I
give
think?
one suggestion only.
Okay, okay. What I think, the major, we can make a advertisement, uh, and we can make an advertisement how masks can create a happier and soon a happier world and COVID free world, and and uh, we can what we can pass it through online and offline media, online medias actually, so that people can see it and they can realize uh, the good side of wearing a mask. Also, we should show the bad side of not wearing a mask, so that they get encouraged and stick to wearing a mask. That is, I guess, that might do a great job. Government should basically create a proper mask wearing video or animated video like Mina cartoon. uh, I think Mina cartoon, there might be an episode in Mina cartoon that encourage people to wear a mask, and also portray how wearing a mask, how not wearing a mask can,
Bhaiya, I have something to add. Like,
Actually,
there
actually,
is this
yeah,
page
I
called
wanted to
The
add
Life
that
of
as
Mina.
well.
There is this page called The Life of Mina. There is this page called The Life of Mina,
okay,
and
okay,
I'm the founding member of it. Like, I'm an admin of it.
okay. Oh,
I have
So,
mashallah,
founded it.
nice.
So I might actually use this to spread awareness, right?
Okay, nice.
Um,
That might work. Animation has a huge power. People enjoy animation, and Mina is a very popular character, and people might,
yeah.
especially the children, the future of the country, they will enjoy. Also, youth like us, they are fan of Mina, so this might work.
Yeah. So there is this one way to create more and more awareness about wearing mask. And last but not the least, um, a lot of people get infected with coronavirus, right? And after that, they're getting out of home without getting tested for it. Now, how logical is it? Like, if someone is facing the symptoms, and even know that they have COVID, but i- despite knowing that they're going out of home wearing a mask, now, does that really prevent the infection, or uh, other people also get infected because of them getting out of home?
What I have seen in this recent Omicron variant, this is highly contagious. Highly contagious. This is spreads like, what shall I say, like typhoid, cholera in earlier times, like 1970 or 1960. If there were one patient in a family, there would be many other who were. It's like food poisoning actually. One of the family member is infected and the other must be. So this is highly contagious, and I would strongly recommend not to go outside wearing a mask in a confirmed COVID-19, for a confirmed COVID-19 patient. He should, stay in his or her room, maintain the
So
isolation period of at least 7 days. At least 7 days.
we can actually come to a conclusion that masks can prevent COVID-19 from spreading, but then again, if someone is affected with COVID-19, they cannot go get out of home even after wearing a mask, right?
Yes, yes, yes. Absolutely on that.
We should create awareness more and more. Now, I will ask Fahim to add something. Like he was supposed to add something.
All right. We have almost come to the end of this podcast, I think. I have asked all the questions I wanted to ask. And thank you so much, Minhaj Bhai, for giving us your valuable time from your extremely busy schedule and for such an insightful session. It was a masterclass session from you, and I think we all learned a lot from you, and we listened to you like ardent students. And I'm sure our viewers will be benefited from this podcast, and I hope it will answer many questions of our respective viewers. So we can end our podcast
And
here.
and again, I have like the last question I wanted to ask. At the last question I wanted to ask, can I like stream
Acha,
something?
okay, okay,
All right. Wait a minute.
sure.
Let me find that video. But the last thing I wanted to show is like um,
আমার ফোনে এত ছোট দেখা যায় আমি
ভাইয়া
কিছু দেখি না।
দেখা
আই
যাচ্ছে
হ্যাড টু
দেখা যাচ্ছে
আমার ফোনে এত ছোট দেখা যায় আমি কিছু দেখি না। আই হ্যাড টু লাইক লুক ইনটু দ্য
আচ্ছা ভাইয়া
অ্যাজ
এখন কি দেখা যাচ্ছে
Yes,
ওকে
আচ্ছা
হ্যাঁ
ভাই
your,
জাস্ট একটা
your screen
রিয়াকশন
is
একটা
visible.
রিয়াকশন দিন ভাই
দেয়ার ইজ এ
প্লিজ
ভিডিও
রিয়াকশন
হ্যাঁ প্লিজ
একটা
মানে
রিয়াকশন দিন
জুম ইট হ্যাঁ জুম ইট
জি ভাই
ওকে ফেসবুক ভিডিও হ্যাঁ I'm not sure what is it saying.
Tuan,
I don't
অডিওটা
think we
আসে
can
নাই।
hear this video.
আমরা শুনতে পাচ্ছি না
can
বাট আমি
can any of you hear this video
No, no, no. You can send it to me, and I can actually
আচ্ছা এটা
share the
হচ্ছে
screen.
গিয়ে গ্রুপে সেন্ড করা আছে ইউটোপিয়ান
Oh, okay.
So you can send it again, I guess.
alright fine take your time
So I think it's basically a video where where a person says that I want to wear a mask, right?
না yeah ওটাই
হ্যাঁ আমি আসলে কিছু দেখি না আই হ্যাভ টু
জি ভাই
লিটারালি
ভাই ওখানে
লুক ইনটু দ্য
একটা
অ্যাজ
ভিডিও ভাই
ক্লোজ
ভাই একটা ভিডিও একটা মানুষ বলতেছে যে আমি মাস্ক পরবো না তো পরে জিজ্ঞেস করছে কেন পরবেন না সো হি যে আমি আগে 4টা পড়তাম 3টা পড়তাম 2টা পড়তাম পরে আমার কোভিড হয়েছে আমার মার কোভিড হয়েছে সবার কোভিড হয়েছে
Okay. Can you see the screen,
হ্যাঁ
guys?
হ্যাঁ the screen is visible
Okay.
স্টার্ট কর
করি না করি না না ওয়েস্ট অফ মানি মনে করি আপনি কয়টা বলছেন আমি একসময় 3টা পড়তাম যখন ভয় পাইতাম শেষ পর্যন্ত হলো বাসার সবার হয়েছে মার কোভিড নিউমোনিয়া হয়েছে 90% সিভিয়ারিটি তারও বাঁচালো আইছি সমস্যা হয়নি কেউ মরে নাই তো হয়েছে তো সবার আপনি একটা বলছেন আমার বাবা আমরা গেলে আমি 3টা পড়তাম 4টা পড়তাম ভাবে পিড়াইছে একটা সময় 4টা পড়তো টাকা নষ্ট করেছে একটা বা 2টা পড় পিড়াইতো 4টা পড়তাম শেষ পর্যন্ত দেখলাম জ্বর জেলা হয়ে গেল হইলই এরপর তো মনে হয় মাস্ক ফাল দোষনি মন্ডাতে মাঝে মাঝে মাস্ক ব্যবসা উড়াই দিই মানে আর কি ওনার তো একটা সম্মান আছে না সাধ্য হচ্ছে সম্মান করলাম শাহরিয়ে জাহান করি না করি না
So I think we all heard what he said. So Minhaj,
বলা
what's
আছে
your
ভাই
take?
আমি না শুনতে পাইছি উনি কি বলছে the fact is this is not a binary thing, this is not like 0 or 1, like this is not like you cannot this is not like yes or no, this is not something like wearing a mask tick, not wearing a mask cross. The mask wearer will not get COVID-19, and the person who is not wearing mask must get COVID-19. This is like there are multiple layers. uh, what we want to do is we want to create lesser chances of getting affected by COVID-19 through wearing masks. This is what we want to create. As you wear masks on a regular basis, there are lesser chances of getting COVID-19 than a person who is not wearing masks at all. So this is what we want to do, or this is what we are trying to do. We are not trying to say that if you are wearing a mask, we are giving you the guarantee that you will not get COVID-19. What we are trying to convey, or what we are trying to assure, is we want to create lesser chances, or we want to allow COVID-19 to get us infected in lesser incidents. That is what we want to create. This is like there is a there is multiple layers. The more people, you know the more you are wearing a mask, these chances, the from red to white, the red zones are getting replaced by whiter zones. This is not like, if you are not wearing a mask you will get COVID-19, and if you are not wearing a mask you will get COVID-19. This is not like this. This is not a binary thing.
ইয়েস অফকোর্স লাইক অনেকেই এটা ভাবে যে মাস্ক আমরা কোভিড মানে কোভিডকে ফাইট করার জন্য শুধু মাস্কই এফেক্টিভ এন্ড মাস্ক আমরা ওই জন্যই পড়তেছি বাট
Also,
মাস্ক অলসো আমাদের
I want to add something to that guy's point. He was saying that I have survived, my mother has survived, nothing has happened to any of us. I have my mother has been saved even from the wrath of death.
90%
But what I
severity.
want to say is, the COVID-19, once you are getting affected with COVID-19 badly, the amount of hospital expenditure, this is significantly higher for a middle or even higher middle class family. The whole family get stolen a lot of money. If you have to admit even a single person of your family for hospitalization or for COVID-19 treatment, things go beyond our hand. And even if the patient is saved, or the person is saved, or the family member is saved, this causes a huge amount of economic loss. So what we want to create is, we do not want to want people to go through this trouble. And once you are going to hospital, the other member of the family also getting affected, because there are more chances, more exposure. Also, there is another thing. There is something called viral load. It's like something. ধরো আমি যদি বলি, ধরো দুইটা টিমে খেলা হচ্ছে, অথবা একটা টিমে একটা ক্রিস্টিয়ানো রোনালদো লেভেলের খেলোয়াড় আছে, বাকি 10টা খেলোয়াড় হচ্ছে নর্মাল। আর আরেকটা টিমে there are 5 ক্রিস্টিয়ানো রোনালদো লাইক প্লেয়ার। তাহলে কি হবে? যেই টিমে 5টা ক্রিস্টিয়ানো রোনালদো লাইক প্লেয়ার আছে, that team will create more havoc, or that team will have the higher chances of winning the match, right? এখন
Yes,
আমার বডি যদি ভাইরাল এক্সপোজার, ভাইরাস কোথায় এক্সপোজার হইতেছে, দিস ইজ ভেরি ইম্পর্টেন্ট। লাইক আমি যদি এখন আমার বাসায় কোভিডের এক্সপোজার পাই, there are chances that the amount of viral exposure I will have is significantly lower than আমি যদি hospital exposure পাই, তাহলে there are chances that I will have a higher amount of viral exposure. The number of virus in my hospital is significantly higher than in my home or in my house. So this is very much important for a virus to cause virulence. The number of or amount of virus in your body is very important. If there are lesser amount of virus in the body and a lesser amount of viral multiplication, these will you will pass through this virus very easily. You will have only sneezes or coughs, maybe some weakness. But if you are exposed to huge number of viral load, huge number of if you are having a huge exposure of virus, then you will have a higher viral load. They will multiply more rapidly. You will have no chance to combat them. and you will have severe symptoms. You might even have to, get admitted to ICU. These are the points that we want to address and we want to combat. Not necessarily like all only combating COVID-19, but also reducing the severity of COVID-19. This is also important. We want to focus on that. We want to save life. Yes, we want to reduce the number of cases, but also we want to save lives. And for saving lives, we have to, make sure that our people are not exposed to a huge number of viral load at the very first point. I think you got my point.
Yes, Bhav. Yes, Bhav. Surely I've understood the point actually, and I think we can end the discussion here. Thank you everyone for listening to us, and
Uh,
thank you everyone, Sabik Bhai, Tuan Bhai, Alfi Bhai, and Minhaj Bhai, everyone for being here with us for such a long time. And okay, I'm ending
and
this.